Welcome back. The Western Cape Health Department is urging police to take urgent action as assaults on pregnant women increase. The department says hospitals in the province are receiving a high number of women who've been assaulted. It's believed this may be after women disclose their pregnancy status to their partners. To discuss this further, Health Intelligence Strategy Cluster Director Dr. Melvin Moodley joins me from Cape Town. Dr. Moodley, thank you so much for your time. So tell us first of all what the statistics say exactly about the number of assaults on pregnant women in the Western Cape.
Good evening, Anli, and good evening to the viewers. So let me explain how we get our statistics and what we're looking at. So we are looking at statistics from the 1st of January 2021 to the 18th of June. So it's a very close to real-time system. And we use a data system called Hectors, which is in public sector emergency departments. And what we found when we looked at the data, we looked at trauma in general, and we found that if we looked at trauma in general in women, we found that 33.3% of all trauma in women was due to assaults. But then we looked at pregnant women, so we have a way of laying over the data, and we can look at those women that are pregnant. And what we found is, in pregnant women who experience trauma, 52.1% were 52.1% of the trauma was due to assaults. So the proportion of assaults in pregnant women was actually higher than women in general. Now, what got really interesting and perhaps sad is that when we looked at the data on pregnant women, we noticed something unusual. What we saw was that there was a disproportionate number of assaults in the second trimester during pregnancy. So if I look at the data, we see that 29% of women experience assaults in the first trimester, 45.5% experience assaults in the second trimester, and 25.5% experience assaults in the third trimester. So there's something about the second trimester that causes, for some reason, women to be assaulted. Now, we don't know the exact reason. The second trimester is the time when women most obviously start to show that they are pregnant. And one possible theory is that this is when they disclose their pregnancy to their partners, but we can't be absolutely certain. And so what the data is suggesting something, we're drawing and making an assumption. What we have to do is to test this robustly through further research.
Dr. Moodley, if you're saying that one of those hypotheses is that this could be the time when women disclose their pregnancy to their partners, is that corroborated by who these women are saying the perpetrators in these assaults are? Are the majority of assaults committed by close partners?
On this data set, unfortunately, I can't draw that inference, because we don't have enough depth to this data to say that this was due to intimate partner violence. Unfortunately, the layer of the data only gives us up to the point that it is violent, it is assault. We don't go beyond that. So it wouldn't be accurate for me to make to hazard a guess on that.
So comparing these numbers to what you've seen previously, is that a marked jump, and what's believed to be the motivation if that is a drastic increase?
So when we look at the data, we look at a wide range of data. So I'm actually going to look at or draw your attention to the recently released stats by the South African Police Services. The reason I'm doing this is that the data that I've just indicated to you is a relatively new set of data. So we don't have longitudinal data to accurately indicate if there's an increase or a decrease. What we are seeing is that the pattern is consistent, that a higher proportion of pregnant women are assaulted than non-pregnant women, if you compare pregnant and non-pregnant women, and that most of the assaults occur in the second trimester. But if we look at the South African police statistics for the first quarter and compare it year on year, we see that there's been a 22% increase in murders, 37.2% increase in murders in children, and a 70.5% increase in murders in women. There's also been increases in rapes, sexual assaults, general assaults, and assaults with grievous bodily harm. And I think the story that data is saying, whether it's for the entire province or whether it's for the Western Cape, is that there is an increase in crime, and that's manifesting in people coming to hospital and presenting to our emergency departments. What I would say is that if there are more assaults, then there will be a larger proportion of women presenting and a larger proportion of pregnant women presenting due to assaults.
Based on the information that these hospitals, public hospitals, provide, are you able to pinpoint whether certain of these facilities show more assaults on women and pregnant women?
We should be able to, if we go into the depth of the data and compare hospitals we compare different hospitals, we would be able to do that, yes.
That's certainly going to assist police because you've called on the SAPS to urgently intervene. Is there cooperation between your department and the SAPS to put together a plan based on the information that you've gathered to try and assist women?
Yeah. So, Annie, that's a critical feature of the Western Cape safety plan. So we're trying to improve safety in the Western Cape, and that's safety in terms of homicide, safety in terms of assaults, and safety in terms of sexual offenses. And that involves working across departments so in the Western Cape government, we work with the Department of Community Safety, we work with the City of Cape Town, and yes, we work with the South African Police Services. One of the things, I come from the Department of Health, so one of the things we do is we share our data, including the data I've just mentioned to you, with our partners in law enforcement, and we hope that they can use that to take action to decrease crime. Some of the examples would be deployment of what we call LEAP officers to high-risk areas, and we also choose specific times to deploy LEAP officers so that they are able to intervene when the crime rates are highest, which is mostly on weekends and at night.
Well, thank you for sharing this information with us. A very important topic as we see crime stats in general worsening. Thank you very much, Dr. Melvin Moodley from the Western Cape Department of Health.